Dupixent or dupilumab is the go-to drug for moderate to severe atopic eczema. Many patients are started on Dupixent with the belief that it will be the final solution, the ultimate cure for their atopic eczema. But what happens if Dupixent fails? Recent studies have shown that 50% of people with eczema are dissatisfied with their treatment. Their dissatisfaction stems from incomplete responses, sleepless nights, intense itching, and generally poor quality of life. Patients who are started on Dupixent have already gone through a long list of treatments, including emollients, topical steroids, calcineurin inhibitors, oral steroids, phototherapy, immunomodulators, and in some cases, even antibiotics and probiotics, so that if Dupixent fails, it can be a real conundrum. So, what are the options left after Dupixent fails? Recent studies have shown that many patients who are classified as having failed treatment with Dupixent have concomitant illnesses or have been misdiagnosed as having atopic dermatitis, atopic eczema. One of the most common causes for non-response to Dupixent therapy is the presence of allergic contact dermatitis. And for that reason, it is advisable to do extended series patch testing before making a diagnosis of atopic eczema. But other diseases can coexist or be confused with atopic eczema. These include genetic diseases, infections, immune deficiency syndromes, drug reactions, or even some types of lymphoma. In their guidelines for the diagnosis of atopic eczema, the American Academy of Dermatology recommends that a diagnosis of atopic eczema only be made after certain diseases have been ruled out. These include scabies, seborrheic dermatitis, lymphomas, photosensitivities, contact dermatitis, both the irritant kind as well as the allergic kind, ichthyosis, psoriasis, as well as other types of erythroderma. In fact, if you do not see at least 80% improvement over the affected areas of your skin after 3 to 6 months of treatment with Dupixent, there is a high likelihood that you have a concomitant illness or have been misdiagnosed as having atopic eczema. In one study involving 50 patients who were classified as having failed treatment with Dupixent, 100% of them had a concomitant disease or were misdiagnosed as having atopic dermatitis. So what happens if no concomitant or alternative diagnoses are found? Successful combination therapy of Dupixent with topical steroids, phototherapy, or immunomodulatory drugs such as methotrexate or azathioprine or cyclosporin or mycophenolate mofetil has been reported in the literature, and some investigators have reported increased response rates by increasing the frequency of dosing of Dupixent to once weekly, although this was not reflected in the initial studies that were performed on the drug. And Dupixent has a cousin, Adbry or tralokinumab, which works in a slightly different fashion. More recently, 3 medications from a different class of drugs have been made available for the treatment of atopic eczema. These are abrocitinib or Cibinqo, ruxolitinib or Opzelura, upadacitinib or Rinvoq. Baricitinib was approved in Europe for the treatment of atopic eczema. Ruxolitinib is a topical agent that is indicated for mild to moderate atopic eczema. This class of drugs can have serious side effects and is not intended for combination with other immunomodulatory drugs or biologicals. So, in a nutshell, if treatment with Dupixent fails, we should make sure that there are no other concomitant illnesses or alternative diagnoses. We can combine Dupixent with any of the other therapies mentioned above, or we can try one of the new JAK-STAT inhibitors. I hope you found this video useful. If you did, give it a like. Support the channel by subscribing. Until the next video, stay healthy and stay safe.